Hello, and welcome to another episode of Revive and Thrive. This is episode 10, and I'm your host, Joshua Blum. I'm a psychiatrist, and for the past couple of months, we've been doing a podcast as a part of this group, which is about burnout. And we've been going through the alphabet, A to Z. Today's episode is brought to you by the letter J, which in this case stands for join. Joining as opposed to operating solo. One of the things is true, well, I don't know if it's necessarily true for everybody, but I think a lot of us guys, particularly in the West, we have this idea that we have to kind of do it ourselves. Individuals, the idea of kind of coming together and with other people is not necessarily always something that we're probably bred to do and maybe raised to do. And if you've ever had a father who got lost because he didn't stop for directions, like mine, then you kind of know how that goes. And one I know area in my life that I've worked on is being able to ask for help, especially earlier before things have gotten to a tipping point. We have an expression in mental health circles that if you're not getting anywhere, then maybe the right people are not in the room. And by that meaning that you probably need additional support. Maybe you need additional information. Maybe you need additional input. Maybe you just need a fresh point of view. And so that carries over in a lot of different ways into our personal lives. One of the things that's often true about folks when they are physicians and burning out is they sometimes get into a place where they feel like they have to do it by themselves. No one really understands what they're going through. In fact, maybe no one really does, or very few do. And they are shouldering a lot of responsibility that they don't necessarily, or they're not necessarily always successful in passing on to other people. Being able to delegate things to other people is, of course, a learned skill, but in some cases, it just is not practical or feasible to do it for everything. If we think about aspects of our personal lives, it may be possible to outsource things like yard work, housework, those kind of things like that to other people. There are some parts about what we do in our day-to-day lives that you may also be able to do the same thing for, faxing things, making phone calls, requesting records, all these other secretarial kinds of things like that you may in fact be doing. Obviously can be outsourced to somebody else, and you may already be doing that to some degree. That's not exactly what I'm talking about, although that's certainly part of it, and that's always a thing that is good to think about. I'm thinking about the idea of joining together with a support network and the other right people in your life, just like the right people being in the room to help you with a patient. It's just a critical area of the picture to consider for your own happiness and your success. What would that mean specifically for your work life? One of the things that we kind of touched on before is mentorship. Really, really hard to find in some areas. You may be the only person in your particular area that does what you do. You may be doing let's say you're sort of the proverbial small town doctor, hang up a shingle. You may be in fact the only one. It sounds romantic to some, but it also could be very lonely if you've been there, and there's certainly a lot of pressure that is put on you to do that, to maintain a certain front for everybody that you come across. Being able to shoulder the burden for things you don't understand, things that you want to outsource, is not necessarily always easy. So how do you find those people? And how do you ask for help? A couple just different ideas. Professional organizations, they have their uses. They probably cost a lot of money in many cases. You may feel like they don't necessarily apply, or like you get a whole lot of benefit out of them. One of the things that if you're not a member of your own professional organization, at least looking into it and seeing if it's worthwhile, like even be able to go to meetings, maybe even just once a year, or have access to online trainings and things like that can be pretty helpful. I know I always feel a member of two. I'm a member of the American Academy of Child Analysis and Psychiatry, or ACAP. They have a meeting every year around Halloween. And I always come back, if I go to it in person, or the last couple of years they've had a virtual option as well, which has been handy because that often is a busy time. I don't always have it off. I always find myself being invigorated by it because you come across a lot of people who are sort of in the same boat with you. It gives you a sense of joint fighting against the machine is kind of how I always think of it myself. I always find that one helpful. I'm also a member of the American Psychiatric Association. They have a meeting in May. And then at various times I've considered joining other ones. There's another one for neuropsychiatry. They usually have a meeting sometime in the spring, and a few others over the course of time. Not all of them I can be a part of. I would say most of them I can be a part of only tangentially. But I often do find those meetings helpful, at least if I can even if I can only go to one or two of the things here and there, I always find it to be invigorating, as I mentioned before. For some people, they don't go to any of the lectures or educational kinds of things like that. They go to the meetings where it's like a working group. They'll have like a little working group or a caucus on a certain topic. Maybe it's something that it's not big enough to warrant a meeting by itself, but there's a few people that, kind of will gather together and share information. That can be a great place to share stuff with colleagues who you may not be able to see in day to day, but you, at least nationally or internationally, it'd be helpful to connect. I would say another particular thing is that if there are groups, on, say, Facebook or other aspects of social media, specifically for your particular specialty, it can be pretty helpful. You may be able to ask questions, commiserate over various things, etc. So the online community can be helpful. Another thing is that in your particular department, it may vary. You're kind of all thrown together because you have a shared profession, but you may not necessarily have a whole lot in common. If there isn't necessarily colleagues you can connect with, and if you don't have anybody else in your department, or there's very few people in a department, there are obviously very few chances for that, or if your department is very dysfunctional, the leadership is all over the place, there are meetings, but you can never make them, or there's just no sense of shared cohesion, I would look to at least one person within the organization as a whole, or in your workplace that maybe you can connect with. It might be someone that you share patients with, and you can kind of commiserate, or you can at least learn from each other. I think it often works best if you can if it's a two-way exchange of information. So on a lot of consult services, for example, if you think about how those are set up, primary service has a question. They consult X, Y, or Z, say pulmonology. Pulmonology comes, sees a patient, and says, here's my recommendations. That's fine. It's sort of a one-way exchange of information, where really the primary service is the main beneficiary. Obviously, the secondary service, like in this case, pulmonology, they get the billing and all that kind of stuff like that from that. But on the other hand, they're sharing their knowledge mostly. However, it often works best if it's a two-way street. So in other words, if it's set up so that it's colleagues as opposed to consults. So by that I mean and this is again like a systemic kind of thing. So if you can set it up so you're working kind of hand in hand with somebody else. So I'll give you an example. In a lot of mental health settings, this has been over the last, 5 or 10 years, there's been more co-located mental health. So a pediatrician, for example, might hire a child psychiatrist to work in their office to see the patients that they're having difficulty with. However, child psychiatrists will also be able to see how pediatricians approach various things and may, in fact, hopefully also learn from management of, say, related conditions that have a mental health implication, asthma, GERD, headaches, all those other kinds of things like that. It's a bi-directional kind of thing. Rounds, when you do rounds, and each person is a member of the team and they have their own role. There's no one member that's sort of more important than the other. It's all important for it to work cohesively. So if you have the ability to be a part of a multidisciplinary team where you're not the center of it, even if you're sort of the one that's kind of leading it, you're like the identified leader, like in some cases primary care functions as the sort of the identified coordinator, I guess, of all these different services. And so in those particular cases, even though someone might be the identified quote unquote leader, they were organizing it, everybody has their own part, right? There's no one that's necessarily more important. So I would say multidisciplinary kind of treatment can be important and very helpful and invigorating in some cases if you're not a part of that. Or if you have a chance to be a part of some kind of thing like that, even if it's non-clinical. There was a neurologist that I worked with when I was in fellowship who he was a solo private practice for the most part, but he would do an IRB type of thing once a week, where he would be a part of a group and they were all talking about research-related things, and that worked for him. It might be something like that where it's not necessarily, clinical in terms of patients, but it is, you're working with people that are either related in specialty or totally different. And then lastly, one thing that comes to mind, of course, is mentorship. Being able to find mentorship can be incredibly helpful. And I don't think necessarily everybody's going to reach out and say I would love to be your mentor. Or you'd be asking them, can you be my mentor? You could, of course, do that. And I'm sure plenty of people would love to do that or be flattered by that if you asked in that particular way. However, that's also a lot of pressure too. So in some cases, what some people will do is they will look for someone who just knows more than they do about a particular topic and just ask them questions. Or if you find yourself working together with somebody and they are sort of guiding you or teaching you in certain things, they may be able to guide you in other things as well. And they may be your sort of go-to person to ask questions for whatever it is. If you look at people who have gone before you, they may be able to guide you in ways that can help you save some time when it comes to your career. Not necessarily clinically, although it could be that, but it could also be in terms of your department or how to navigate things like research or how to navigate, well, should I take this job or not? It can be really helpful to have that. Very hard. I would say it's kind of hard to find because often you need to have someone who's probably older. There might be, and it's a little weird if there's like a power differential. I mean, a chairman, department chairman could be that. I mean, that would be ideal, but they're also evaluating you maybe, and those kind of things naturally come about in residency. So if there were people that you were close to in residency, never hurts to contact those people again. Okay, I have a question, and in many cases, they'll probably be happy to talk with you. I run into some of my former mentors at national meetings, and that's one of the things that has been really helpful about some of those meetings. In some cases, you may in fact have to set it up in a formal way where you have to pay for mentorship or supervision. Not necessarily a bad thing to do. I mean, in some cases, that is the only way to really make it a thing. If it's not scheduled in such a way, then it probably is not going to happen. The other way to do it would be to kind of informally do it. This happens, I would say, I know this happens in mental health circles because it's sort of an offshoot of like therapy. A lot of therapists will sometimes meet together for like what they call group supervision. So and sometimes I would say there's not necessarily as much of a tradition in the medical side of it, the psychiatry part of it, but it certainly could be. There's no reason why it couldn't be to kind of have a kind of rounds where you discuss patients, case conferences. And that works for a lot of people. So if you are like in the hospital where I work, there are rounds that meet, like once a week where they'll discuss like complex cases, like a tumor board type of thing where they'll discuss those kind of things. And that could be very helpful if there's some way you can get involved with that where even if it's not your own patients, you might be able to offer support or learn from somebody else. Or in some cases, maybe you can present your own patients there and gain a second or third or fourth set of eyes on something which again, offers that fresh point of view. So I think in many ways, we're talking about ways to expand your own vision so it encompasses more people. In other words, to sort of share the burden, in a sense, which of course, hopefully will help lighten the load. So that's it for this week on adding people to your support network in a professional context. So talk to you guys next time. Have a great weekend.